So welcome everybody to today's video where Mark Dalauidao is going to talk about his role as an infection prevention and control site lead. Mark is a registered nurse and he's going to give you lots of tips on how to become an infection control nurse as well. So thank you so much, Mark, for giving your time up today. This is in your own time and I really appreciate it, and I'm sure the viewers will as well.
No, thank you. Thank you, Carol, for having me. It's a pleasure. It's a pleasure.
Thank you. So I thought what would be helpful, Mark, is to start, maybe just tell us a little bit about your nursing career to date.
Perfect. Yeah. So I am an NMC registered nurse here in the UK. I think it's been like 18 years now since I first qualified back home in the Philippines. That was 2006, I believe, if I remember it right. But yeah, so I've been a registered nurse. I finished my Bachelor of Science in Nursing back home in the Philippines, and then moved to the UK around 2010, where I decided to come and study initially. So it's not the same pathway as the other internationally educated nurses that they are hired directly from the Philippines. But I came here to further up my education. So I studied a Bachelor of Science, honors degree in international healthcare and nursing. That's back. I graduated, I think, 2013 from the University of Northampton. And then further on, I think I've completed my a master's degree in infection prevention and control back in 2021, just after the pandemic. And I completed that one from the University of West London. So going back to my career progression, so in 2016, when I started working for the NHS, so 2016, that's about like nearly 10 years now. So 9 years and 1 month to be exact, actually.
Oh,
Yeah, so 9 years and 1 month since I joined the NHS. That was 4th of January 2016. And yeah, so currently, as Carol mentioned earlier, I am the infection prevention control site lead in one of the biggest trusts in Kent area. But before joining infection control, I was a hyperacute unit nurse and became a thrombolysis nurse. So I go to A&E and do the thrombolysis for the patients who were query or confirmed with acute stroke episodes at that time. I love that job. And then I moved to infection control back in 2018. Yeah, so back in 2018, I moved to infection control until within the last 5 years, probably from 2016, I became a band 8A in infection, or matron in infection control in one of the largest teaching hospitals in London that time, before I moved to Kent as an 8B infection control site lead. And yeah, so that's, I think that's one that's an achievement itself for me, because as an internationally educated nurse, it's not a common common thing that you can go to that level within the last 5 years, or within the last 7 years to be exact, until I became an 8P. So I'm just so grateful with all the mentors and colleagues that I had in the past, because if it weren't for them, I wouldn't be in this place. They believe in me, and just so grateful for all the opportunities, really. And I would like to share one of my greatest achievement to date. Actually, when I was involved with in managing the infection prevention and control at the London Nightingale Hospital, together with the leading clinical nurse specialists in the country at that time, when the pandemic hit the UK. The first wave of the pandemic, where we managed I don't know, Carol, if you still remember, or any of your viewer remember, that's back in 2020, 2021, where we opened the Excel, the big conference
yes, yes.
area. They make that as a makeshift hospital to accommodate most of the critically ill patients, because in acute trust there's no available beds for critical ill patient at that point. So yeah, so we were there. Can you imagine the chaos there? How infection control was? That has been really challenging, because there's no hand wash basins in those areas. Yeah, so we have portable ones, but it's not on every single patient. So we have to ensure that the infection prevention and control is still at the heart of our service back then. But amidst all the bad publicity about the London Nightingale Hospital, that it was a waste of money and all of that, I beg to disagree. To be honest, if you are there during that time working in that area, uh, you wouldn't dare to to think or say
Yeah.
things like that, because yes, it has been planned to accommodate about 5,000 or more patients, but then again, because of the number of patients that we've only admitted there, about probably less than 100 or not even 80, at least majority of them, I think probably 95% of all the admitted patients there who are critically ill managed to go back to their families, which is for me, it's a big achievement. So I wouldn't say
Mm.
it was a waste. Yes, probably we've I mean the government probably spend a lot of money, but if it weren't for that makeshift hospital, those people who managed to go home or to go back to their families wouldn't be here if
Yeah.
that's in place. But yeah, so first and second wave of the pandemic, I was there. I was like really happy and thankful for that opportunity. If there's one thing that I'm grateful for the pandemic, that was really that opportunity. That's once in a lifetime opportunity to be part of a national team giving service to the people, and that's pretty much amazing, really.
It's really wonderful that you shared your career. And what's really interesting is talking through how you managed to develop your career through networking and through taking those opportunities. And we're going to talk a little bit later about some tips for developing your career, Mark. So that's really helpful for you to share your career. So talking about your current role, it's interesting because you've got a real leadership role in infection control now. Do you want to say a little bit about what you currently do? What does that role entail? The site lead, infection prevention and control site lead role.
Yes, as an IPC, Infection Prevention Control Site Lead, I provide, of course, infection prevention and control expert, clinical, managerial, professional, strategic leadership, to a multidisciplinary team, ensuring that the IPC the infection prevention and control is integrated into the organizational strategy and service development of the trust. So I lead the operational IPC operational day by day, and at the same time, of course, at the back of that one, the overarching aim is really to facilitate the reduction of healthcare associated infections. We know that there's loads of healthcare associated infections out there, but then again, our main responsibility is to make sure that every infection prevention control measures are in place in order for us to prevent or to minimize. It's the truth is we cannot eradicate the risk. The risk will always be there. So as an IPC professional or an IPC practitioner, our main role is to minimize that risk in order for us to provide the best care for our patients, really, because healthcare associated infections, they are how do you call it, they are avoidable. Yeah. So if
Yeah,
we
yeah,
infection prevention and control measures in place, then we can minimize that, and we're gonna provide a stress-free for the patients. They have a better patient outcome, and of course a better patient journey, which we wanted to provide in every trust, I believe. And of course, as an IPC clinical nurse specialist, we have a wide range of responsibilities. Yeah, most common misconception I just wanted to share with you, Carol, and your viewers. Most common misconceptions about us, infection control team, is that we just go around, going around telling off people like you're not doing this, you're not doing that. But then again, little did everybody knows that, you know, that's not it. That's probably a portion of the roles and responsibilities that we have at the moment. And yes, we go around, and I think that is the picture of the infection control practitioner that we wanted to change over time now. Like if we go there, everybody, which is good though. Like every time you go to a clinical area, everybody's like, shh, everybody's gone. Where are they? They're it's either they're in the clinical base, or some of them are like showing you that they're washing their hands, they're using alcohol, which is good then, which is good. I think it's good that your presence alone can change behavior. But what I wanted really as an infection control leader is what I want is they don't just do that when I'm there or the infection control team is there. What I want is to embed to their practice all the infection prevention and control measures that they need. Because what I want them to understand is it's not only for their patient, it's also to protect them, all the PPE, all the hand hygiene. It's not only to protect our patient, but also to protect all the healthcare workers within the hospitals. And that's what I wanted them to understand. Like, what I want them to do is to improve their own practice and to have that ownership. I know when to wash my hands, you know, and I should develop that capacity to make sure that I know when is the right time, when is the perfect time for me to wash my hands, or when to use soap and water only, or when to use alcohol gel only. So these are the things that it's a continuous challenge, but then again, I think we're hopefully we'll get there. Yeah. And yeah, so going back to your question, what other responsibilities that we have? So as I've said earlier, there's loads of um aspects of the delivery of the entire healthcare in one trust that we are really involved. For example, we are involved with clinical audits. Yeah, so we do clinical audits and surveillance. So audit, like for example, your hand hygiene audit, your personal protective equipment audit, your environmental audit, your clinical practice audit. With the surgical site infection, we have our own clinical surgical site infection surveillance nurse, which is really useful, and we are looking or monitoring the activities of hospital-acquired surgical related infections. So we all do those audits as well. What else? We are also involved with the contamination of use probes. We are as infection control clinical nurse specialists, we need to make sure that they are compliant, not only with their paperwork. It's not only a tick box exercise, but to make sure that their environment where they are processing all those probes or scopes are really compliant, from having a automated dishwashers, how they're gonna clean them before they're gonna put in the automated dishwashers. All of that, we are also involved with them. So it's it's pretty much exciting, really. Really interested in infection control. What else? We're also involved with environmental cleaning, and I have a passion. I have a bias on this one because I love working with the cleaning team to make sure that the environment, this is the most how should I say, this is the most overlooked aspect of the infection prevention and control. If you talk about infection prevention and control, because we only look at cleaning if there's an outbreak, if there's an infection. But why can't we do it as a normal routine, like every day we are bang on our environmental cleaning? So I'm doing a lot of projects with with our domestic team at the moment on how we can improve the practice of the cleaners. That's one of my passion, really, to motivate them and to make sure that they are appreciated as well, because the morale of the domestic team are really low. They thought like, oh, I'm just a cleaner. And every time I hear that conversation from them or with them, it just breaks my heart. Like, your role is equally as important as anybody's role. Doctors, nurses, whoever they are, your role. Actually, in infection control, your role is paramount. It's very important. If you are not there, then the whole hospital, will gonna be dirty, and of course, the risk of infection and outbreaks were gonna be increasing. Everything. So part of that project is to give them motivation on how they're gonna look at cleaning, because some of them, because of their morale was really low, they just show up and do their job, and they're not doing their best. So
Yeah.
the project entails now is part of that is to motivate them, have that good relationship with their supervisors, in order for them to have that extra boost that I'm doing this, and my role is important, and this is for the patient. And that's what we're trying to accomplish at the moment, which is, I think, it's getting really, really good. And I think this is actually a adaptation of my project that I've done from my London hospital, and I've implemented here, but different focus, but still focusing on the domestic staff, which is having a good turnout as well, because that project of mine, I was able to go to conferences, present them, not only national, but I was given the opportunity to present it internationally
Wow.
when I did it in the ICPIC in Switzerland, Geneva, Switzerland. And yeah, so as I said, I'm passionate about cleaning. So if you want to talk about cleaning, yeah. Yeah.
Oh, it's amazing. I mean,
Yeah.
you've given us some real insights into the role. What's really apparent is the compassionate leadership for starts coming across, but also communication and working with others. And I know people going for infection control roles on the job description, it often talks about other team members and I mean, I think people will be interested to know how does the role fit with other team members, so across the trust and organizations outside your trust. So that communication goes across internally and externally. So do you want to sort of talk about that a little bit, just in case anyone goes for roles in the future?
Yeah, so definitely, how can I describe it? Because infection prevention control team, as a team, it's kind of we are connected with every single team within the hospital. Not only within the hospital, but we also go out in the IC, in the integrated care board level, in the regional level, the UK health security agency level, up to the NHS England. So we have that thread where we are communicating, constantly communicating, and liaising with them in order for us to make sure that our practice within the trust is also compliant, if you like. Yeah. So, but within the trust, to answer your question, within the trust. So, as I've said earlier, we are involved with cleaning. So we are really we are constantly working with our cleaning team. We are involved with decontaminations with the decontamination team. We are also involved, I don't know if everybody is aware, we are also involved with water safety. So we are constantly working with our states and facilities in order for us to make sure that they are compliant with the water sampling. Is there any pseudomonas, is there any legionella in the environment or in the water within the hospital? So if there are any cases that we see some, then we have remedial actions that we need to make sure. And infection control team is monitoring that making sure that states and facilities are carrying out the right approach or the right remedial course of actions for those infection issues that are identified with water safety. We are also liaising with um, estates again for built and building environment. For example, if there's a minor or major works in the hospital, so it's a must that infection control team should be part of the plan from the very beginning, from the planning stage, where to put this hand wash basin, where to mount this hand dispenser or sanitizer or whatever. So we have to be there so that at least when we complete the job, there's not much remedial actions to be done, because most of the time, if IPC team is not involved and they're handing over the facility, infection control, can you come and check? If the time that we are involved is just at the end, and we might say, you know what, this hand wash basin shouldn't be in this side, in this part of this room. So there's more of it will create more of a problem than more than anything else. So it's better that we from the very beginning we should be part of the planning. We also provide we also liaise and communicate with all our ward managers, matrons from different levels of nursing as well. We need to make sure that we provide assurance to the executive board as well, to our DIPSI and deputy DIPSI, that we are as a trust or as a site, we are doing everything that is being asked based on the guidelines that we have at the moment, and all the uh, rules and regulations that we need to comply with. So as I've said earlier, within the trust, that is our main frame. And but then again, we constantly work with our regional and integrated care board in order for us to make sure that, for instance, if we see a rise of C. difficile in some of our clients or some of our patients that are coming to the hospital, which are community onset, we liaise with them, we inform them that we have this patient had stool sample sent and became positive for C. diff. So they review them, oh, this patient has been having coamoxiclav, like 3-4 courses of coamoxiclav from the GP. So we know that potentially that might be the source of that infection. So there is a good harmonious working relationship between the acute trust where I'm working at the moment and the community. So it's really good. So it's really a specialization that uh how to say it, like dips into every single aspect of healthcare delivery, really, which is really challenging, and at the same time it's really fulfilling, if you like.
Lovely, thank you. And that's really helpful insight for anybody preparing for an interview, for example. It's absolutely pouring outside, so I don't know if you can hear the rain. So I've been putting my mute on, but hopefully you can hear me okay. I think it's starting to go down a bit now. So quite a few of the listeners will be aspiring to become an infection control nurse. Now you're very senior and you mentioned about getting a master's. What helpful advice have you got, really? Sort of what professional experience, qualifications does an infection control nurse need? So, for example, do they need their masters, or what tips can you give for experiences and academic qualifications for anybody out there aspiring to that role?
Before I answer that one, let me tell you how I managed to get into this role. Yeah. So honestly, I didn't have any infection control experience, like formal infection control experience, when I joined the infection control team from my previous trust. I'm not even a infection control link. So the only thing that I have is my practice at that time, because infection control is everybody's responsibility. Whether you have a position or you have a role as infection control link or not, we have that responsibility to make sure infection control is part of your good practice. So that's all I have when I applied for the role. So I was offered a band 6 role at that time. But then again, what I've done is I've spoken to my manager and say, what are the chances of me having a course or a pathway for a master's degree? Because it's a good thing that I did my honors degree here in the UK. It's easier for me to do the master straight away, because I think that's the challenge for internationally educated nurses at the moment to go and have a master's degree, because I think our academic level is not a par with the UK educational system. And if you won't gonna get like a cumulative units, courses to fill that gap before you can be qualified or eligible to do the masters, then you won't be able to. But fortunately, I had that honors degree, and then straight away, initially they said we can only offer you after a year or two. And then I said, honestly, I said, I would really appreciate, because I know that I learn more if I'm doing theory and at the same time doing the application aspect of it. And just so grateful, they said yes. So after a few months with the team, they sent me for my master's. That's why I finished my master's degree quickly. Okay. But so that's how I did my further education with infection control. But going back to the question now, there's no specific qualification to be on entry level for infection prevention and control. You don't need to have masters at that point. If you have, then that's a really, really good plus or merit during your shortlisting and your interview, but you don't need to, because infection control, if you don't do the role, you won't learn it. So as I think the main aim is to be part of the infection control team, and then you go from there. Because when I started working with infection control, yes, I know the basic, but then again, there's more into it. As I've said, if you are working in the clinical area, your notion about infection control team, they're just there to do this and do that. But then again, there's loads of it. There's loads of say other things that they have to do. There's loads of RCAs or rapid reviews that they have to do. All these infections that we have to review every time. Not everybody knows about that. But as what I'm trying to say here is, if you are part of the team now, infection control team, you learn all of that. And at some point, if you have that agreement now with your manager, can I have at least a course? in infection control, or RCN is also providing a infection control module. Who else? RCN, Florence Nightingale Foundation, they have some infection control modules as well. I think the Florence Nightingale is free, but the RCN, I think you have to pay something. And some universities are offering foundation in infection control. As a manager, I think most of our applicants, they have been trying to do some modules, which is really good, because if you're the one shortlisting, as you're aware, or you're the one like doing the interviews, it's really a good thing that, oh, this candidate is really aiming to be, an infection control specialist, isn't it? Because you know that they've exerted effort to do these courses. But there are some nurses who probably has equal passion about joining infection control team, but haven't had that opportunity to do those modules. So what I advise them normally is, like, for example, if clinical staff came to me and said, oh, I wanted to be part of your team, what should I do to prepare? And my thing is, be the infection control link in your clinical area. Because in that way, like for example, within my trust, I do a bi-monthly training for all infection control link practitioners. So that's additional knowledge and skills that you will learn. And then if your manager will ask you if you want to do some courses, even if the manager say do another courses, just say, can I do infection control as a basic foundation of infection control? Then that's one thing that you can do. If you're really passionate about infection control, volunteer yourself. Can I be the infection control link in our ward? Or, and if you have that opportunity to get the course, get a foundation course for infection control. The master's degree is not really a requirement for you to be a band 5, band 6 in the infection control, but as you climb up the ladder, it's not still a requirement, but it's really a good additional merit for you, because if you're the one shortlisting, of course you want to see someone that has further education. But as I've said, it's not really, it's a requirement, because there are some infection control practitioners who has been there for a long period of time. They've got that extensive experience, and they haven't had their masters. But that's, that's probably a different era, if you, because as of the moment, I think it's more about now of what further education that you have achieved in order for you to have that support, to support you in your application as a infection control clinical nurse practitioner or specialist in a higher band, if you like. But yeah, so those are the things that you probably can do in order for you to progress with your be part of the infection prevention control team.
Thank you, Mark. So really helpful tips there for somebody that's, if you, so you basically, what you're saying is you can start from an early career nurse, but again, it's about creating those opportunities, linking with your manager, looking at a link nurse role, which is like a voluntary role really
Yes.
in your area, and linking with your infection control nurses, networking, study days, taking those opportunities. What would you say if somebody, what sort of transferable skills are you looking, because you're obviously interview a lot of people for infection control nurse roles. What sort of transferable skills are you looking for, Mark?
With infection prevention control, I think what I'm really looking for is if they really, one, if they really have the passion for infection control, because as an infection control practitioner, it's very challenging because we go out there, we challenge people. The way we communicate to people is very important. Your good communication and your good interpersonal skills is a key, because most of the time, if infection control specialists go to the clinical area, and if you challenge someone, for example, and the tone of your voice is very important, because most of the time, if you say why you didn't wash your hands, why you didn't put your PPE, if that is the tone of your question, the person that you're talking to will be in the defensive mode, like probably looking at you from head to toe, like, who are you, because most of the time, if you don't communicate your message as effective as possible, it will create tension rather than you encouraging them to improve their practice. So for me, I always stay with my core value. This is me. This is how I approach things. They know me as the tone of my voice is really like this. How I talk now, and I always go back. That's my core value at the moment. But as a leader and as an infection control clinical nurse practitioner, I don't know if your viewers have heard about the push and pull theory. Like, you know when to push and you know when to pull. Yeah, because it's very important. You know your core value, you stick to it. But then again, if you think that you need to push a little bit or you pull a little bit, you need to learn when the perfect timing to do that. Because as I've said, with infection control team, we are asking people, we are improving their behavior, we are asking them to comply. But if we don't do it the right way, we won't get that compliance. But it's not also good when you just just what's the term, if you're like so lenient. No, that's not good with infection control team as well. You need to be polite and firm at the same time. As I've said, you need you if you can also push a little bit if you need to. For example, if someone is rude already, but then again, as I always tell my colleague Carol, honestly, like when we talk to people, like for example, you see a non-compliant or they breach some infection control measures, don't ever talk to them in front of other people. You pull them in one side, talk to them there, because of course it's the ego that will gonna be affected there, isn't it? Like, because there's loads of instances already. There's loads of not only in my trust and but my previous trust as well. Like they come to me and say, "Oh, this colleague of yours is like this and like that." It's not new. It's. But then again, sometimes it all depends on how you communicate with those people, because always remember what you're trying to do here is to gain their trust, to gain their compliance, and you can only do that if you do it the right way. So communication and interpersonal skills is very important, Carol. Leadership skills, we are leader in our own way, so it's not necessarily that you have to have a position for you to be called a leader, because there's loads of our healthcare assistants and our band 5 nurses that are, you can really see how they command, or not command, but how they present themselves, and you can just feel like, oh, you've got a very good leadership skills, you have a very good organizational skills, you see. And with infection control as well, I think one transferable skills is also your ability to deliver a talk or teaching skills, if you like. Because we always do teaching every single time in the corner, in the corridors, wherever you are. Sometimes we have all those opportunities to do some teaching. It might be a long sessions or it might be a short session in the clinical areas. So we do all of those. And I think if you're an entry level nurse in a clinical area, you're doing all of this. You have all this opportunity to practice them. But then again, as you have said earlier, creating that opportunity for yourself, reaching out the right people, talking to right people in order for you to be given that opportunity to improve those skills, which is really really useful to become an infection prevention and control. And of course, um, more than anything else is your knowledge of us as well with all the infections. We don't talk about infection. There's loads of infections. We are not really expecting everybody to know every single one of them, because even if you ask me, I don't know every single one of them. I still go to my manual, or I still go to the book if there's anything that I'm not really sure. And that's one thing really. With I think that's one of the tip that I would probably say, not only if you want to become an infection control, but in every specialization that you wanted to push, I mean to achieve or to aim, is ask a question. Don't ever be ashamed of asking a question, because I myself, as I've said, I'm still asking questions. I even ask my band 5, I even ask my band 6 or my band 7. That's why you are called a team, because you complement each other. And if you feel that you're the leader who knows everything now, you are not in the right frame of mind. Because as I said, I depend on my team, and I develop my team. At the same time, I depend on my team, and for you to create that good harmonious working relationship is essential. in infection control team. So those transferable skills, being human is there. There will be challenges at some point, but then again, it's how you maintain that respect and making sure that you remain professional all the time is what makes a good team. If you like, yeah.
Thank you. Really helpful advice there. And you started to allude to some of the challenges, Mark. So, for example, people not adhering to national and legislation or policy, health and safety, infection control policy. Just thinking about the role generally, are they the main challenges, or what are the, because I ask this to everybody, what are the main challenges in an infection control role, prevention role? And how do you sort of overcome them? Now, you talked already about sort of communication and how you take people aside, etc. But is there any other sort of challenges to the role?
Yeah, so as you mentioned about the engagement from the clinical team is one of the challenges that we continuously battling at the moment. But one, I think another challenge would be staffing wise, because there's not much infection control team in the country. Um, and I think that's one of the biggest challenge really, like the turnaround of staffing is really quick as well. They move from one area to another or one trust to another, and this cycle of training the new ones and then they'll go then another one again. It's difficult, especially if you're only a small team, and then if one is off sick, there's no one to man the service. And as a manager, I think the main challenge for me is sometimes if I don't have staff and it's just me or just one member of staff, then of course I have to park all the managerial roles and responsibilities that I have and work as an infection clinical nurse specialist, which I still do even if I have a full team. I do go around the clinical area, I review bloodstream infection cases and all of that. But it's just so challenging when you go back now and try to finish your work as the manager. But that's an ongoing one. But yeah, so that's one of the challenges of the staffing. Also, implementation of policies with all the changes sometimes, like just to give you an example, Carol, during the peak of the pandemic, really where the policy or the guidance in terms of around personal protective equipment changes every other day. So can you imagine, everybody was so anxious in the clinical areas, everybody was so afraid, they wanted to protect themselves and all of that. And with all these changes, like frequent changes, one after the other, um, created a lot of chaos, and the blame was all down to infection control team. Make up your minds, why you keep changing, not realizing that the guidelines that we're following is from the national team. And of course was studied, especially from the transition of a long sleeve gowns with FFP3 mask to just the gown, just to surgical face mask and the apron. So that was a really challenge because everybody was like so comfortable now wearing all those, suits and everything. Then how come we're moving to this very, they thought that it's not effective because they're not covered. And those are misconceptions, isn't it? And the main thing that really so difficult for us to let staffing the staff to understand is that the more PPE you wear, the higher the risk you're gonna acquire that infection. Because the main thing is, yeah, it's okay, you put them on properly, but the removal of it is can be challenging because the main reason why we have to implement the strict donning and doffing at that point, it's because we don't want the staff to acquire the infection if they've breached any of the stages. Because the main reason why we want them to start from this stage to that stage is because we don't want them to contaminate any of the PPEs before they even go to the patients. The same when you remove the PPE, which PPE you need to remove first? Is it the apron? Is it the gloves? Is it, all of this? So we need to teach them at that point because what we don't want them to do is to to acquire that infection, so like self-inflicted infection because of non-compliance with the PPE. And up to now, actually, with wearing of mask, at that point, even at that point, the mask is on your chin, the mask is dangling on your ears. People are thinking that they can be protected if they wear them, but if they don't wear them appropriately, if they
Mm.
don't remove them appropriately, then they're putting a higher risk rather than preventing any of these infections to to be acquired, and yeah, so those are the main things really. As part of the short staffing I was telling, I just wanted to share actually, Carol, that I'm doing a mini project at the moment about sustainability in terms of manpower of infection control team within my trust. At the moment, all the infection prevention control link nurses I have, because you meet them every other month, and you meet them almost every day in the clinical area, and those staff who got potential, and you can see that they're passionate with the infection prevention control. And what I'm trying to do now is, because they have a protected 15 hours devoted for infection control role, so what I've done is liaise with their managers. Or are you happy to let, for example, Carol to be part of this mini project? So the project mainly is for that infection controlling practitioners to spend 1 day each month with infection control team. They won't gonna be working as infection control link practitioner, but they're gonna be like part of the infection control team. So I'm gonna do a structured training with them as if they are working now as an infection control team. As I've said, staffing is quite a challenge within my team at the moment. So for me doing that, because as of the moment, I think I've got 14 who signified their interest already. So can you imagine if I have them once a week? So maybe I have one additional staff member once a day. That would be really, really good. And at the same time, I'm preparing them to be an infection control practitioners in the future. And I think that's one thing for me to, you know, the issue all the time is money. We don't have money to hire someone else or to add additional staff. So might as well think outside the box. How can I maximize my infection controlling practitioners?
Mm.
And this is one way, very, very innovative way of encouraging them. Since you're interested in infection control, I'll offer you a training as an infection control nurse, then we'll go from there. And hopefully, you see, if some of us are not here anymore, then you're the next generation of IPC within the trust. And that's a good thing because they know what's the ins and outs of the trust already. It's not that difficult to adjust because they are aware and they know what our like, expectation and how they're gonna deliver the service. And that's what one of the projects that I'm doing this year. We've started this year actually to meet those challenges that we've mentioned.
Amazing. And that's really good because you've talked about challenges, but what you've really shown as a leader is you've identified an area that needs support and that you're linked it to a sort of quality improvement project. And so being proactive and, like you said, thinking out of the box of any of these link nurses that really want to become, it's almost looking at a career development day, really, for them, for people that are aspiring to become infection control nurses.
Yeah.
So that's wonderful. So, I mean, you've given us so many insights, Mark, for the listeners, but I finally want to leave just with a few tips because often people watching this are students or newly registered nurses. So I always ask the speakers, have you got any tips for anyone aspiring to become an infection control nurse and starting out in their career? Just a couple of real key tips that you think help.
Yeah. So apart from what I've mentioned already, how you engage as infection controlling practitioners in your clinical area, creating that conversation with your manager to do some courses, I think as a general rule for me is in choosing your career pathway. If you think that infection control is the one for you, or whatever you wanted to take in the future, you need to make sure that you wanted it and that you actually have passion on it. Otherwise, you will not succeed. Yes, you might be good. You can adapt to the changes. I'm infection control now, but I really don't like infection control. If that is the behavior, then you won't be able to give that 100% to that specialization. Unlike if you like what you're doing, if you're happy with what you're doing, then it will show and you will flourish. You will succeed in that specialization. And every opportunity that counts, just take it. Always give your best in everything that you do. That's what I would like to mention, because I think from experience, that's what my mentors have seen in the past, where I can see potential in you, I'll develop you. Your manager sees everything. You might not think that they know you or they know how you work, but they do. And if they see that potential in you, if they see that passion in you, then there's no manager that won't support you if you really wanted to progress into any of the specialization in nursing. But in infection control team, you need to love infection control so that at least you'll be able to flourish within this specialization. And always, has been my mantra ever since. Always practice what you preach, because in infection control, you can't go there and ask them, wash your hands, why are you wear your PPE if they see you yourself, you're not even compliant with the infection control measures. So it's how you present yourself out there also helps in gaining compliance within the clinical team. So always practice what you preach, so that nobody can turn around and say you didn't do this, you didn't do that. I am I am very confident that in my 18 years of nursing career, I've been by the book. I can bend, but I've been by the book. I always love to have students with me, Carol, because that way I am forced to do everything right. That's why I really love having students with me, and that has been my practice really. Nobody can turn around and say, I didn't do this, I didn't do that. They know that if Mark is on the shift, these are my expectation. And I'm so grateful that I've gained that trust and respect from my colleagues at present and previously, and my first few years in my nursing career in the UK. So yeah, so just if you like to be an infection control team, just go for it. Start reaching out with people whom you think that can help you. And I just wanted to openly say to everybody, if you wanted to contact me at any time, any point, just get my details with Carol. A part of my advocacy really is training and education, and be a mentor and coach to all the aspiring infection controlling practitioners. And in fact, within the Filipino community, we've created this association now. We've gathered every Filipinos in the infection control uh, world, if you like. And it's very useful because we are asking questions, giving our own experience, and we're learning from each other, honestly. So that's really good. And just so, yeah. So if you want to become an infection control team, start now. Now, time to start. Okay.
Thank you so much, Mark. And you're such a good role model. You can see that passion. And it's the tip that you've given about having a passion for the area is very important. And I recently spoke to some students about finding the right area for them, because sometimes that can take time. And infection control might not be for everybody, but by spending time with infection control nurses, shadowing, you can really see if that role's for you. But there's always a role out there for somewhere for you. But it's finding that passion is so important, isn't it? Because you need to enjoy your working day,
Yeah.
don't you, Mark? So thank you so much. You've given so many insights, and I just wanted to, my listeners will be really appreciate your time today. So thank you so much, and I hope everybody enjoys all the wisdom that Mark has shared today and finds it useful. So thank you.
Thank you. Thank you very much. Thank you. Thank you, Carol.